All right, here we are. This is our workshop. It's Thursday evening, February 18th, and welcome to 3 ways to rejuvenate your lower back or your achy back. That's what we're going to talk about. So I've got the Q&A window open here, and I've got my chat window open. Before we even go forward, I need to ask you guys for a simple favor. Just let me know if you can hear me, and if you could see my screen here before I even go forward. We'll get started in a moment. Just give me a little bit of love online here. Just give me a little chat. Let me know if you could hear me, you could see me, and then you can see my slide. Because I tell you, one time I did a awesome, Joe. Thank you, Jerry. I did a workshop one night and I got halfway through and they didn't even see my slide. So I was like, oh my God, let me just start off, make sure that all you guys can see that, right? All right, folks, let's get started. Now, this workshop is for you. If you have back stiffness, you have back pain, discomfort, you want to get rid of it, of course, right? Don't we all? And you want to be able to bend and you want to move freely. And it's also for you if you don't want to be worried that your back is going to go out at any time, right? Stopping or changing plans because, I don't think my back's going to handle it. Or you don't have back pain and you want to keep it that way. So those are the reasons why you're here, right? And I will say this is that you do not have to accept that back pain is a normal process of aging. It's not a normal process, not a normal part of aging. We just dispel with that myth right away. Now, the things that you're going to learn tonight is that you're going to find out if we don't treat the cause of your back pain, it's going to come back. And probably some of you have had that experience, right? So we're going to find out why the source of your back pain isn't always the cause. We're going to talk about some exercises that you can do in a couple minutes of a day to maintain your back. It's like any type of medication, right? If you have like some type of other health problem that you're required to take this medication every 4 to 6 hours, it's sort of like that. We need to find some exercises that can fix your back, just like medication, but without the side effects. And also, you're going to learn about the key to preventing it from coming back. You want to be able to build resiliency and decrease that anxiety about if your pain will prevent you from doing what you want to do, right? So, what's in it for you if you stay? You're going to stay pain free, right? You're going to be able to fulfill your role in society, in life, at work, at home. You're going to get back to doing the things that you love to do, get back to working out, getting back to losing weight, exercising, playing a sport, playing with your kids or grandkids without pain. And then you're going to improve your mood because you know what? Pain makes you grumpy, right? It puts you in a bad mood. No pain, you get a better mood, right? It might even cloud your judgment when you're making decisions, critical decisions like about at home or at work. So, we're going to talk a lot more about that and how pain is not just something that like, oh, it just hurts right here. No, it hurts and it affects everything. So, an important note, this is my disclaimer here. If you're dealing with pain, this is going to be a general information workshop. It's targeted to a broad population. So be aware that if you do have a problem, you might need a customized assessment and treatment plan so that we can get to the true root cause of your problem, right? So this is not physical therapy. It's not medical advice. But I will say this is that the things that we're going to talk about today or tonight have helped thousands of patients that I've treated in the past. I'll tell you this one story, very interesting case. I was treating this gentleman. He had this long-standing chronic back pain. He was a landscaper, and he went to other physical therapy clinics, had bouts with chiropractors. He was taking oxycodone for 10 years when he had come to see me. And what we looked at was, I asked him, like, you've had this pain for over 10 years. What have you been doing to make it feel better? It's like, all right, well, I've tried physical therapy. I've also went on the internet, YouTube, looked at videos, how to fix your back, stuff like that. And he tried that out. But none of it really worked because it was so general. But I'll tell you, the biggest thing that made the difference for him in getting his back to be more mobile so that he could stand and do his job was I went out to his car. I went out to his car because he had to drive from job site to job site, and his car, he had this big bolster in the driver's side here, making him in this position, this arched back position. So he was driving like that, and he thought it was what was it was supposed to be, support your lower back, and his back was locked in that position, and it had adapted to that dysfunctional extended position for all this time. So we had to wean him out of getting rid of that bolster and allow him to kind of flex and extend and move his spine, and eventually got better. So that's just a little story. But oh, if you're going to stay till the end, I've got a special offer for all of you tonight. I'd also like to congratulate you all for attending and coming in, because this is going to be the first step to getting that rejuvenated lower back. So, who am I? My name is Dr. Paul Kachoa. I'm a physical therapist and owner of Par 5 Physical Therapy. I've been in the physical therapy field for over 20 years. I got my doctorate back in 2010, and I started working in various clinics. And you know what? What got me here was that I had my own personal journey and experience with back pain. Back in high school, I was in the weight training room, I was in the football gym, I was doing a deadlift, and I picked up this weight off the ground, and I felt my back pop. I felt this pop in my back. I never forget it. And then I dropped the weight and I just fell to the ground. And then I went to the doctor the next day. And we found out that, he diagnosed it as like a disc issue or something. And then I went to physical therapy back in, the 80s. And then I hurt my back a second time when I was in college. After a long day of playing volleyball, long day of volleyball practice, I sat down for dinner, and I was sitting there having dinner, and my back felt a little bit sore, but nothing out of the ordinary. I thought, like, yeah, it's fine, right? And then I went to stand up after eating dinner, and I couldn't stand up. I was like bent over. My back was like 90 degrees. I was looking at the ground, and I was like trying to climb up the stairs and lie down. And that's my second major issue, um, being treated by a physical therapist. So I've had experience of seeing physical therapy and back pain treatment from both sides, as a patient and as a medical care provider. So, over all this time, I've found out what works and what doesn't work. Actually, right now, I'm going to launch this poll. If you guys can see this, I'm going to ask, you know, if you've ever tried physical therapy before. So I'm going to allow you guys to vote for this. I'm going to launch this. So you should see the poll pop up. Just click yes or no if you've tried physical therapy before. And, I'll give it about, 20 seconds or so, and then we'll see the results. All right. I'm going to end it right there. 18, 19, 20. And that's the end of that. And there we go. So the majority of everybody has had some type of experience with physical therapy to treat your back pain. Right. So that's good. That's very interesting, because you guys all know, you folks out there know what physical therapy is. So I might not have to talk too much about that. But I will also mention this other note here. We have a Q&A. We have a chat room here. Go ahead and put things up, and I'll answer them at the end. But don't mention personal info, because, this is going to be recorded for a later replay of people that weren't able to come tonight. And also, if you have specific questions, text or call me here, 973-490-4955. We can get conversation started, and we can set a time to talk. All right. Also, we're going to go through these exercises. And the rule of thumb is that we don't want to cause any more pain. If you are in pain already, the goal is to get out of pain. So don't push through pain. Go gentle, go slow, be cautious with the exercises. And we're going to try and do these frequently throughout the day. We want to combine them when you're working, when you're reading, when you're on your phone, stuff like that. So you don't have to set aside time, a strict amount of time throughout the day that you're going to, like, all right, this is my exercise time. Just do them when you can. All right, fit them in. All right. So why the source? This is where we dive in, right? why the source of your back pain isn't always the cause. All right, what's that big question? So the other poll that I want to find out is if you do have back pain, um, what's your first treatment option you think about? Okay, so let's launch that again. Let's launch this. So, what's the first treatment option you think about when you have back pain? You're like, oh, my back hurts. What's the first thing that pops into your mind? It's like, all right, I need to get this fixed today. And we've got a couple votes casted here, 20 seconds. I'm going to end the polling soon. 17, 18, 19, and 20. Here's the results. Well, the majority is the chiropractor. There you go. And only 10% are saying physical therapist. Chiropractor is the go-to thing. All right. So thank you for that. All right. Then we're gonna talk about that too. Who do we go to when we have back pain? Right? Do we go to the PT? Do we go to the chiro? All right. So anyway, we want to unpack why the cause and the reason aren't always the same. We first have to understand the structure, right? So this is a big graphic about your spine here. You have your cervical, thoracic, and lumbar. We're going to talk more about the lumbar today. And what is it? What is the spine? Well, it's got joints, right? It's got discs in between, and we have nerves and muscle fascia. But you know what? Ultimately, the spine is a resilient structure. It's made up of these vertebrae. They're stacked on one another, and they have joints in the back. We'll talk more about that. And they have this disc, which is sort of like a jelly donut in between. It moves. It kind of absorbs shock. And then you have nerves coming out of the back, and then muscle and fascia too. That's the biggest thing. That's not shown on this picture, but muscles and fascia give us stability, allow us to move, and hold us up against gravity. And we're going to talk about the core muscles as well. All right. So this is probably something that you already know about. 3 common causes of back pain. The first one, muscle spasms, right? It's when a muscle gets tight and it doesn't want to release. So but let me ask you this question, is it tight or is it a weakness where it's just trying to work so hard and it's super weak? And then, why does the back get tight? Is it because of a muscle imbalance? Does stretching help? If you stretch out that tight muscle, does that help to relax it? Muscles are basically layers of tissue, right? So we have layers of tissue, and then you have the fascia around that. The fascia is this connective tissue that gives our body its shape. I like to always say that muscle without fascia is hamburger meat, right? So for everyone who eats hamburgers, that's basically a visual there for you. So these layers of tissue need to move. They need to slide on one another. They need to elongate to stretch, and they need to contract. They need to get shorter. And that's like in a three-dimensional pattern, three-dimensional structure. So if there's a disruption in that sliding component of those tissues, sometimes you'll get this muscle spasm where the muscle just kind of seizes up and it doesn't want to let go. So another reason is a joint dysfunction. The joints that I mentioned before in the spine, these are called facet joints. They're set up like shingles on a roof, right? If we bend forward, that's called flexion. The facet joints open. And if we go into extension, we go backwards, that's extension. The facet joints close, they slide. So it slides open, slides closed. And these surfaces can get dysfunctional. They can get degenerated. They can have arthritis. So you can imagine that either they get inflamed or they're not smooth, they get rough. That can cause those facet joints to get stuck, right? Another common cause is a disc pathology, something that goes on with the disc. The disc is basically like a gimbal, right? It sits in between these two vertebrae, these two stacked bones, and it has a harder outer surface, a hard outer covering, and a very soft inner. And that can kind of absorb the shock and move in all three dimensions. But you could also get disc herniations or bulges, and sometimes the disc kind of moves and you get impingement in between the joints that can cause other issues. And if you do get nerve issues, that's usually associated with pain that goes away from the center, away from your spine, either into your glute, into your butt area, or down the leg. Right? But what is pain? Pain, you know, I will tell you this is that your pain can occur in the complete absence of what we just talked about in the previous slide. It can occur in the absence of tissue trauma or damage. Pain is very complex. The brain is the key. There are certain factors that play into if you have pain: physical, neurological factors, psychological factors, social or situational. Ultimately, pain is an electrical signal that comes from some part of your body, rides up a nerve, and then gets into your brain, and your brain has to interpret this signal. And we each have this sensitivity dial to pain in our central nervous system. And sometimes that central nervous system sensitivity switch gets goes haywire, right? You can imagine how would you feel? Picture this. You're in the wrong side of town. You're going down a dark and dangerous alleyway. You can't see everything, but you hear the noises. You can't see. It's like very dark and it's dangerous. So you can imagine your heightened sense of threat, of stress. You're always looking around, very scared, right? So that's the level of sensitivity. Now, imagine this: we're in Cancun or Aruba in the Caribbean on a beach. It's nice and sunny. It's snowing now in New Jersey, so it's going to be hard to picture this. It's nice and sunny. You're in a lounge chair and you could feel the sand in between your toes. And if you put your hand down, you could feel it with your hand. The rays of the sun making you warm. You could hear that beach, just kind of the waves kind of hitting the beach there. Now imagine, the difference between those two situations, right? And that's like your brain. People can be relaxed and not have a lot of pain sensitivity, or they could have this heightened threat. And that heightened sense of threat will give us more sensitivity to pain. A lot of times, people who have issues with back pain that have lasted more than 6 months, we classify that as chronic. And chronic back pain typically goes through this cycle. First, we have to reduce that sensitivity, right? Before we address the physical issues of back pain. So, treatment is often aimed at addressing the results and not the causes. All right. So treatment is often aimed at addressing the results and not the causes. So that means that, all right, I've got this pain right here in my back. Okay, let's work on your back. All right. You're gonna lie down on a table. I'm gonna crack your back. I'm gonna massage it, whatever. Right. But if we only treat the pain, that's only a temporary relief. All right. That's why you don't feel better. The pain comes back. No one treatment is the answer. All right. So we have pictures here of chiropractic surgery, massage, exercise. Medical knowledge changes every 5 to 7 years. New research comes out. It changes what we know causes back pain, how we can treat it, and what are effective treatment strategies. I will say that the new research says that passive modalities are less effective than active modalities. What does that mean? Passive modalities is when you're lying down on a table and someone is doing something to you. You get your back cracked. You don't even have to do anything. Or you just lie there and get a massage. It feels great. Those are passive modalities. But those are less effective at treating the root cause of back pain than active modalities. And we'll talk a lot more about that later on. So we need a combination of addressing all those neural causes, the nerves, central nervous system, that sensitivity, and the mechanical causes of pain. So if we combine the two, then we can ultimately get to the root cause and get rid of your pain. Because pain is a fluid experience, right? It's influenced by many factors that we talked about: stress, hydration, your fatigue level, the type of environment you're in, your beliefs, your previous experience with back pain. Like when you're happy, you have less pain. And then when you're stressed or sad or upset, you feel more pain. So Let me ask you this question. Answering this question can help drive an effective treatment plan. What activities, postures, positions, movements make it worse? All right. I got a picture of this guy shoveling snow. I was just outside shoveling snow a couple hours ago. I was out there. Does bending make it worse? Does standing? Does, sleeping? What makes it worse? Or the other side is what makes your back feel better? All right. Does laying down make it feel better? Sitting, stretching, walking? Sometimes I even have my patients keep a diary, figure out what things make things worse. And it's not just the activities, but because the activities lead us into what postures and positions. Postures and positions are going to be important in understanding the root cause, right? We want to learn about the activities that hurt, and that leads to the positions and postures. And that can lead us into this theory of directional preference and movement restrictions. Bending and extending we talked about, right? So we're about 20 minutes in, and if you're not standing, let's have everybody stand up here. And I want you to just stand up, that's nice and normal, and keep your knees straight, and then just go ahead and bend forward. If you're going to go bend forward, if you can't touch your toes, that's fine, right? You don't have to kind of go all the way down, but just do that a couple times and just kind of feel, what does that feel like in your back, in your legs, in your body? What's the intensity of your symptoms? And when do you get it? Is it during the motion or at the bottom of the motion? Right? And then now we go into the opposite direction. We're just going to put your hands on your hips and then bring your shoulders back. All right? Just do that a couple times. We're just going backwards. So if we're standing here going backwards, we're going to pay attention to the sensations that we feel when we go into that direction, the intensity, the duration, when does it happen, right? And then we look at those positions. Bending forward is called flexion, and going backwards is called extension. So if we kind of play around with those directions, you have to pick, or usually we can come up with a direction that feels worse and a direction that feels better. And that will help drive our treatment plan to getting rid of your back. All right. So this is a key thing that I like to show everybody. The body is made up of this alternating pattern of stability and mobility. If this pattern is disrupted, then pain or injury is the result. Okay. So stable segments and mobile segments, that pattern, right? Alternating pattern. If one of these segments is reversed in their role, then you get pain. So let's take, for example, your lower back, right? Your lower back is red. That means it's supposed to be a stable segment. And if we look below that segment, we have the hip, and the hip is blue. That's mobile, right? It should be loose. It should move well. It's a ball and socket joint. It's got a lot of motion. And then if we look above the lower back, we have your thoracic spine, your T spine, right? That's where all the ribs are. That should also be mobile, right? You should move around, be able to rotate through that area. Now, let's just say, for example, the common thing that I see with a lot of patients that come see me is that their hip turns into a stable segment. They get a tight hip. If your hip doesn't move as much as it should, your body will find a way to get around that and recoup that loss of range of motion. And what does it do? It just takes the back and says, all right, I'm going to make the back a mobile segment. I'm just going to make it all loose. And then what happens is that your back takes too much stress because the hip, or if we reverse that, the thoracic spine, the T spine above it, is not doing its job. The thoracic spine and the hip, they need to be as mobile as possible, so that the lower back can do its job and be stable and not be an unstable or mobile segment. All right. So we got a question here about people are wondering about solutions to sciatica. We're going to talk a lot about that later on at the end. I'm going to table that and we'll circle back to that in the end. So we got to fix and restore this alternating pattern of mobility and stability. And that brings us to 3 exercises to fix your back. All right. They might not be the ones that you think about. My philosophy is everyone should be able to maintain their own body. You should be able to maintain it yourself. so that it can function for years to come, right? I never want anyone to rely on me or rely on someone else to do the simple things that you can do at home to reduce your pain or control your symptoms. Think about it like a car, right? You have a fancy car. You should at least know how to put gas where the gas tank is, right? Which side of the car is the gas tank? You should know that. You should know how to put air in the tires, right? Oh, you got this little thing, put the valve in and plug that in, put some air in the tires. How to maybe add some windshield wiper fluid. That's important, right? You should open up the hood, find the little hole. I could pour in the fluid. So those are simple things that you should be able to do. But if your transmission goes out or your alignment is off, you need to go seek a specialist help, right? So you should be able to know when things are you can do them on your own or when you need to go see a physical therapist or a medical professional to treat your back, right? So these are some things that could help um, maintain your body. This half kneeling hip flexor stretch. We talked about how the hip, it needs to be mobile. All right. So one of the things that happens is that if the front side of the hip becomes tight and you're walking, standing, trying to stand upright, if the front part of your hip is tight, then that loss of range of motion is going to be felt in the lower back because that back is trying to hyperextend to come back too much because you're missing the range of motion of your hip. So this is a video of how to do a hip flexor stretch. Now, again, this is going to be a very general exercise. It's not going to apply to everybody, and there are many different ways to modify this stretch if you cannot get on the ground, if you can't get into this position. So that's my one disclaimer here. But the hip is crossed by a couple of muscles that attach to your lower back and go into your thigh. So we have to make sure that your lower back and your pelvis are stable when we get into the stretch. If you do this haphazardly and don't stabilize the starting points and the end points of that muscle, then the stretch becomes ineffective. You lose the effectiveness and you're stretching out your back instead of your hip. Each stretch that you're going to do, you want to try and hold that for 30 seconds. If you hold it less than 30 seconds, then those tight structures they just kind of snap back into that tightened position. We want to create a permanent change, so we have to hold it. All right. Yes. All right. So we got another question about bursitis. We will talk about that as well later on. And we've got a couple things, a couple guys or a couple patients or someone's raising their hand. Did not know that you can do that in a thing. Yes. Oh, somebody's raising their hand. If you got a question, type it in the Q&A or the chat window, and then we're going to cover those. All right. So this is the next one: cat camel or child pose to cobra. These terms are borrowed from yoga. Right? Yoga is like 1,000-year-old movement practice. I think they know something about mobility. So again, we want to take this slowly and through a pain-free range of motion. You get down on all fours, and you probably have done this before if you've had physical therapy. Cat camel, trying to round out and move your spine through a comfortable range of motion. And you're totally supported because you're on all fours. There's no compressive force of gravity, and you're just going to flex and extend your back. The discs, all the structures that are in your spine, they like movement. They don't like to be stuck. You got to get them moving in some way or fashion. If the cat camel is good, then you can progress to the child's pose and the cobra or the up dog, whatever you want to call it. And I put in there that you have to breathe and relax. If you cannot, if you have that heightened sense of pain, of threat, and your muscles are so tense you can't get into these positions, the first thing that I always advise people is to breathe. If you can inhale and exhale slowly, so it really doesn't matter if you're going to go in or out through the nose or whatever. I just want your breath to be slower on the exhale. Your exhale should be twice as long as your inhale. If you exhale slowly, the muscles will relax. You tap into what we call the parasympathetic nervous system. And then that will help relax the muscle, and then you can get into these stretches a little bit more comfortably. All right. So this is a quick question we could we could answer right now. I'm going to answer this live. What are those muscles that cross the hips that go into the lower back and thigh? The psoas muscle. Psoas. It's PSOAS. Psoas. All right. So now, if we do have a trigger point or a muscle that's kind of spazzed up in the spine, this is one way of many to try and release that. The self trigger point release. All right. So you could take a ball, tennis ball. You could do this in bed. It'll be a lot softer versus being on a hard ground like this. It's more aggressive, right? But you could imagine that you have this muscle that's all balled up and tight, and you want to release that. So again, take deep breaths, relax. You put the ball where you feel that trigger point, and just applying that pressure, constant deep pressure, and breathing and doing these small motions, that muscle will gently release. Okay. So that's how we can reduce that trigger point. All right. So we can pull the knee into the chest. Now increase the stretch, put a lot more pressure on that ball. But again, these are very general exercises. They might not apply to everybody. We might have to modify them for you. All righty, next one. So moving on to the key to prevent recurring back pain. So we've talked about directional preference. We talked about these stretches. So the main thing is when we have or we find out a directional preference, bending or extending, which one makes it worse, which one makes it better, we got to pick one and keep doing it. The magic happens with dosage and end range and end range of motion, right? So think about like any type of medication that you're taking. If you take a 5 milligram pill or a 500 milligram pill, you know which one is going to have more effect. So if we take, for example, the guy on the left here is pulling his knees into his chest. He prefers a bending motion, flexion. Flexion is his directional preference. He prefers to go into that bending, and then you just do that. You do that repeatedly in different positions. You could do that in sitting, where you're bending forward, touching your toes. You could do that in lying. Now, the more that you do it, if you do a set of 10, do it 10 times and like, oh, that feels a little bit better, might feel a little bit looser. Then you just keep doing it. 2 sets, 3 sets, maybe 4 sets of 10 every hour. All right. So that's simple. That's very general, but you just want to pick a direction that makes it feel better and just keep doing it. And then later on, as you are able to reduce your pain intensity, then you can kind of investigate going into the opposite direction and recover that loss of range of motion in the opposite way. All right. Your body knows movement, it doesn't know muscle. So if we exercise and say, all right, I'm going to target this bicep muscle right here, right? I'm just going to work that. That is not how our body moves. Our bodies don't move in isolation. We are a system of systems, right? If you go to pick something up, think of all the muscles that need to work, to return to full function. We need to train positions, postures, and movement, not muscle. We need to include the brain in this programming. I had this other guy on my table the other day, and he has back pain, I don't know, more than 5-10 years, right? Also as well, chronic back pain. And he worked with computers. So I gave it to him in the language that he's familiar with. It's a software versus hardware problem, right? If you just lie on a table and do an exercise, but you don't know why you're doing the exercise and you're just kind of, doing it to do it, and you don't feel where you're supposed to feel it and activate the right muscles and kind of rewire your software, then you're always going to have a problem. So hardware versus software, we can do like a hardware address, right? Where you can have a new knee. Hey, you want a back surgery or you want a back manipulation, you want me to crack your back. So that's how we address the hardware issue. But the software side is where we have to rewire your brain to move a certain way or give it permission. If it's under that threat level of pain, give it permission that it is okay to move in this direction because there's no damage, there's no trauma. Everything is healed from the initial car accident or back issue. We just need to reteach you or relearn how to move properly. So that's software, hardware problem. All right. And we got to control your core. All right. The core, one of the muscles in the core is this thing called the transverse abdominis. The majority of people with chronic low back pain have no control over this. I get them on the table, we try and feel that muscle working. We're going to do that in a second, and they have no idea how to do it. So this transverse abdominis is the deepest muscle of the abdominal set. We have the external obliques, we have the rectus abdominis, that six pack that everybody wants. Then you have your internal obliques, these diagonal things, right? Internal, external. And then the deepest one is this transverse abdominis. It starts on your lower back and it wraps around your belly. If you've had back pain and if you've worn like a back brace, that's your own body's back brace. All right. It's like that Velcro thing. I had to wear it. I wore it a couple times because my back hurt. You know, if you wear it, it feels great. It's holding everything in. But you know what? Eventually, we have to wean you out of that brace because this muscle is key to build your core, build your resilience, and prevent your back from hurting again. And if you wear a back brace, that muscle just turns off. It goes on vacation. It goes to Cancun and never comes back because you know what? You've got this big neoprene thing that's kind of wrapped on your back. That muscle doesn't need to work. So we have to, again, rewire your brain, work on the software, and make that brain and muscle connection to that transverse abdominis. So this is how it sits. Kind of sits like in the middle. It's connected to the ribs, the lower back, and it wraps around everything. It's a core muscle, wraps around like a girdle. What other questions we have here? All right, so that's it. What are those muscles that cross? All right. Wondering about solutions about sciatica. Right, so we don't have any more new ones here. Just want to make sure that I've got. All right. So this is our transverse abdominis, right? We got to get this on. All right. So this is where we're going to test it. You're going to lie down. Have everybody lie down. You're going to check your core. All right. So wherever you are, get on the bed, get on the floor, whatever. You're going to lie down on your back, both knees bent. And then you're going to find your pelvic bone. Your pelvic bone is it's easy to find. It's like this pointy thing that's in front of the pelvis. You just kind of find that and you go in about an inch towards the belly button. If you are relaxed, then it's soft. You can kind of poke in there. And then I usually tell people, pull your belly button into your spine. If you pull your belly button into your spine and you activate this transverse abdominis muscle, you should feel that muscle get tense underneath your fingers. And the next question I ask is, can you breathe? Right? If we're lying down there and you're trying to contract that muscle and you cannot breathe, you can't function, right? You can't control if you can't breathe and you cannot control this muscle, you cannot function, all right? So a lot of times people will use their diaphragm. They'll use their diaphragm to pull up and in to create that tension, and they'll substitute that diaphragmatic lift for the transverse abdominis without even knowing. And that's a software problem, right? The breath is important. We got to be able to breathe, right? The diaphragm's up here. The transverse abdominis, because of all the different layers, you can only feel it like in that low area off your pelvis. So breath is important, not only for living, but for neural control, motor control. So that's how we check. All righty. So this is a recap of what we learned. All right. Pain is complex, right? A lot of different factors that can play into why you're feeling pain in the complete absence of tissue damage. All right. And we need a well-rounded treatment protocol. We need a lot of things to address the neural aspects, the nerve problems, psychological central nervous system, and mechanical issues of pain. Be able to move, and we have to move well and move properly. Then we talked about the hip flexor stretch. Open up the hip so your back doesn't have to compensate for a tight hip. And the cat camel stretch, move your spine through a comfortable range of motion, get it moving. That movement, that contraction and relaxation, that bending and extending through the spine creates like a compression and a distraction of your spine and the discs. And that's what helps keep everything hydrated. Movement keeps things hydrated. And then soft tissue mobilization techniques, how to get rid of a trigger point. You find that tight spot, put a ball on it, relax, breathe into the ball, allow that muscle to relax, and that can, then you could stretch more effectively. And then controlling your key is core. I mean, controlling your core is key, right? All right, what's this other question here? So I have, Jacqueline writes, I have calcific bursitis in my right hip, which has led to lower back spasms. Any specific exercises, stretches to loosen it up, trying to avoid surgery, shots for the hip? Yes, there are. There are a ton of exercises. So one, that hip flexor is one of them, right? So if we're just looking at trying to get that hip to extend, and then flex, how is your bending of the hip? If we need to kind of go into that child's pose position where you're rocking back, that can work, into a hip exercise, a hip stretch. There's a lot of different ways, and a lot of different ways that when we stretch the back, we're indirectly hitting the hip. Hopefully that answers your question. Another one, Joe says, what are your thoughts on inversion tables? Inversion tables, I think they're good. It all depends if you can get comfortably in and out of them and you don't get dizzy or have any vertigo or anything, and that thing is adjusted well, right? So if you're using the inversion table, it's basically taking your body and flipping you almost upside down and just kind of stretches you out. That's fine. It'll control your pain. Maybe it'll feel great, but you know what? Eventually you got to come back to earth and then get that gravity back on you. So it will feel good if you can tolerate being in that position. But ultimately, we have to train your body to withstand gravity, right? And work on strengthening exercises, core strengthening, see if you have any flexibility issues so that, we can get you acclimated to moving against gravity and be resilient. And that means like maybe some lifting some weights, but lifting weights safely. All right. So solutions for sciatica. So a sciatica is classified as any pain that results in pain going down your leg. All right. It could be from a disc at the spine level, or it could be compression of that nerve as it exits that area, and maybe a compression of that nerve in the hip or a hamstring muscle or a glute muscle. Sciatica is just this junk term, umbrella term that says pain in the leg. Right. And because it is such an umbrella term and it could be caused by many different things, one person's sciatica treatment and advice doesn't reach or doesn't apply to everyone. So I would suggest that, maybe we talk a little bit more offline for that and figure out, what exactly is the cause of sciatica. It's a very general term. Not all treatments just work for you. All right. So now our special offer for everyone here. All right. Guys, stuck with me. It's like 8:15 here. So this is my low back pain workshop special. All right. This assessment voucher, the special discounted offer, this is basically what you're going to get. You're going to get an assessment session where we talk about the detailed interview about your history of back pain, an injury review. We're going to talk about what your goals are. Ultimately, what is something that you want to get back to? A question that I ask everyone that comes to see me is that if I snapped my fingers today and got rid of your back pain today, how would that change your life? What would you do tomorrow? Right? And that is my goal. My goal is to get you back and unlimited to doing what you want to do without pain medications, injections, or surgery. All right. Also includes a posture screen, a movement assessment, right? So a lot of times if you go to see a physician and you say you have back pain, do they check how you move? Do they look at your posture? And what type of movements do they look at? And we also do strength testing, flexibility testing, stability testing. We're going to check your balance, check your core. How can you control positions and breathe in them? And then you're going to get a report of the doctor's findings and then exercise and treatment recommendations. So that's a special. This is a 60-minute session where we review your problem. We talk about, what the root cause is. So we start to find out what the underlying cause is and, work to get you better. Now, and if it's something that I can't treat, if I cannot fix it, I will gladly refer you to someone else. All right. I want people, to use this as a as a chance to figure out if working with me would be a good fit. Right? I never want anyone to start a plan of care with me and not know that you'll get the results. Right? We start something, I want to make sure that I can make a change, make an impact on your life. This is the reason, the reason why I'm doing this is that I want to show people how my practice is not your typical physical therapy clinic. You've been to physical therapy before. You've seen how they operate. How long do you spend with the doctor at your physical therapy clinic? 15 minutes, 20 minutes? So each session with me, I spend an hour. And that hour is very much focused, manually driven, so that we can get a lot of things done in that hour. All right. It's not a typical practice. Um, in the end, you'll make an informed decision of whether or not it would be a good fit for your needs. All right. I only have 5 available per week of these sessions. And normally they cost $200. But for all the participants tonight, I'm offering it for $45. All right. And again, the reason why I'm doing this is to show people that not all physical therapy is created equal. I've worked in physical therapy, those clinics that you've been in, and I found that the progress that I was able to give my patients was limited because of the time that I could spend with them. If I could spend more time, I got people better, but it was tough because I had like 3 other people waiting for me. So the lower back pain specialist, you don't take my word for it. I started this practice to change the paradigm of PT, to change the perception of what people think PT is and what it can do. I wanted to make an impact in my life. For example, this top left person here, let's call him John. He came to me last year, and it was the height of coronavirus. It was the height of pandemic. We couldn't see each other. Everything was closed. But I saw him virtually. I did telehealth visits with him, and I got him better, um, giving him directed exercises, video, via the video call, and showing him how to treat his own back and doing different techniques that worked for him. This bottom left, uh, his wife, she had cancer and she had a long-standing back pain. She came to me not being able to bend over at all. She couldn't even touch her knees because her back hurt so much. If she sat down, she couldn't even stand up without using her hands. And when she tried to get up from that bent over position, she had to walk her hands up her legs to get up into that standing position. So I worked with her. I saw her in the clinic. This was before COVID, and I got her moving better and exercising and hiking with her family and doing everything that she wanted to do. The person on the right here, she had a lot of issues going on: back, neck, leg issues, and chronic. And she had seen a lot of providers, a lot of physical therapists, homeopathic medicine, acupuncturist, and it was basically her central nervous system, her body had a real poor time of controlling the muscles that needed to hold her up against gravity. So we had to work hard to get her better, to show her that there is hope, that she can get back to exercising and doing things without dealing with all the stress of her pain. All right. So, oh, I got another question here. It says, I get pain that is triggered at my lowest portion of the tailbone when sitting on a chair, sofa, really anywhere. So that may or may not be from your back. That could be a sacroiliac joint problem. Sitting, that's usually more stress on the SI joint. So your pelvis is basically a circle made up of 3 bones. And the back bones, SI joints, sacroiliac joints, that could be a problem with that. And I've seen, I had this lady in last week that had like an SI joint problem. Her pelvis was like just a little tweaked, and she was having a lot of back pain. She couldn't lunge, she couldn't work out. We just kind of adjusted that, and then she's moving a lot better. All right, so hopefully I was able to answer that. What do you do next? So what do we do next? We're going to take this info and try and incorporate it into your daily routine. I'm going to be sending out an email with a replay and the exercise videos here. And go ahead and request that low back pain assessment offer for workshop attendees only. You can call me here or text me 973-490-4955 or email me at paul@par5pt. I'd like to thank you all for spending your Thursday evening with me, the snowy Thursday evening. Got all my contact info. If you're dealing with pain and you've been to other physical therapists, other chiropractors, and you're still having this problem, give me a call. We could talk, chat on the phone about if it's something that I could fix, some solutions that you could try on your own. I don't want anyone to leave here thinking that, that their back is unfixable. All right. Thank you so much for spending the night. I'm going to stay on for a little bit to answer a couple more questions. I'm just going to stop the recording.